Good evening. We are live at the Turtle Hospital in the heart of the Florida Keys, where our ambulance is coming in yet again with more cold stunned turtles from the upper Keys. We have the team standing by and Madison. How's it going? Oh goodness. Do you know who's who?
Tumor, yes.
Beans. There's Buddy, also has fibropapillomatosis, and Petunia with some barnacles, a juvenile green. So thank you for joining us. We're here at the Turtle Hospital where two more juvenile green sea turtles were rescued in the upper Keys and getting ready to be admitted to the Turtle Hospital. Both of these turtles were cold stunned. Their body temperatures were in the 60s when our ambulance arrived for rescue. So that makes 3 turtles today, and we had 3 new patients come in yesterday. I know northern Florida, they're seeing literally hundreds of turtles. It's much colder there, but our water temperatures for the Florida Keys have been historically low. And you can see little Maria there still warming up in the hospital. You can see the size reference there. Petunia is a little larger, probably 4 to 5 years old. And then Buddy is bigger yet, probably more like 8 to 10 years old. And they are just guesstimates based on size. So you know the routine if you follow us, that when these animals get checked in, they're going to have blood collected so we can run blood chemistry, which is a window into the turtle's health. That information will go to Dr. Terry Norton, our veterinarian, and he will prescribe treatment. And treatment for these cold stunned turtles includes fluid treatment at intake with vitamins. They'll also get measurements. They'll get weighed. And they'll get photographed, x-rays, and then treatment. How their temperatures compared to
66.7 for him, and then 68 for Petunia.
So we're good with 74 in here.
Yeah.
That works out, right? So a busy day here at the Turtle Hospital. We also had one of our ambulances break down to make things even more interesting. But not to worry, we were able to get one of our other ambulances on the road. And this makes a total of 8 new patients from cold stunning that have come in over the past few days. Our temperatures are warming up, and I was told the bay water is up to 57 degrees today, up from 50 degrees on Monday. And tomorrow we're forecast to be in the low 70s. And then another cold weather event is coming through our area on Friday. So we'll have a day of warm weather tomorrow, and then the cold comes through again, but it's only for a few days, so hopefully it won't affect too many more turtles. Looks like Petunia has a barnacle there on her underside, on her plastron. We do use bra clips for tie overs for wound care. Incredible rehabilitation team here at the Turtle Hospital has been very busy manning that 24-hour hotline. And with the care of these turtles, the 3 turtles that you're looking at, Petunia and Buddy, they're on the ends. They just came in just right now. And Maria came in this morning, all from the Upper Keys, from the Bay side. So if you're in the Florida Keys and on the water, please keep your eyes out for these little turtles. What does a cold sun turtle look like? Well, you can see they're not moving very much. They're lethargic. And that is because those cold water temperatures slow their metabolism down. They stop swimming and stop eating. And below 50 degrees can become a mortality event. So these lucky little ones were rescued. Thank you for the stars, Sheila. And they will be warmed up in the hospital overnight. Our emergency room here, we are keeping cooler than normal because we know these turtles are coming in and we don't want to warm them up too quickly. So their body temperatures, as I mentioned, were in the 60s. We are in a room now that's in the low 70s, so that is a good temperature. We don't want to jump more than 10 degrees a day. So these turtles will warm up overnight to that room temperature. They're what we call ectothermal. They're going to take on the temperature of the air or water surrounding them. And then by morning, they should be a good temperature to go into their hospital tank that has a balmy water temperature in the mid 70s. So that is the plan for these turtles. Buddy, who's right here up front, and Petunia, who's on the end there with Diego getting measurements. They've just arrived, and Maria has been here since this morning. She's already received her treatment and is just warming up. And you can see Buddy's plastron or underside looks very clean. There are some tumors in the inguinal area, but not a heavy tumor load, fortunately. Looks like a good body weight. Again, thank you for following along with these cold sun turtles coming in and the work we do here at the Turtle Hospital. Now, Petunia and Maria, they do not have tumors, so we are hoping for a quick in and out. And what does that mean? That means they're going to get fluid treatment. They're going to get warmed up. We're going to monitor the x-rays and make sure they do not develop pneumonia and make sure they don't have bone infections. Both of those things are secondary infections from cold stunning. As you know, with our Kemp's Ridleys that have been here since December, they were severe cold stunning from the Northeast, and they are being treated for pneumonia and osteomyelitis. But hopefully Petunia and Maria will warm them up and they'll get active and they'll be able to go back out into the water. By next week, the water temperatures should be warming up. Thanks for joining us from Port St. Lucie in Florida. I imagine you're probably seeing some turtles come in that area as well. There's Petunia's x-ray. You can see those barnacles. Welcome from Northern California. Thank you for joining us. So Jory is getting x-rays of the body and also those flippers. We're checking the bones to make sure they're in good shape. You may notice right away there's 5 digits in those flippers, just like our fingers. Hello in Northern Indiana. Sending you some warm thoughts there. Hello in Myrtle Beach. Hello in Carolina Shores, North Carolina, and more friends in North Carolina. Thank you for joining us. There's the lateral rad. We can get a good lung view there. Thank you for joining us from Elizabeth, West Virginia, and hello in Indianapolis and Arkansas. Thank you for joining us from Western Colorado. And you can see how quiet these turtles are. And that is due to that cold water slowing down their metabolism. You see little Maria, she's still very quiet. We're going to step out here, see how the bloods are coming. So we are lucky enough to have blood processing equipment here in-house. And Maddie doing the medication calculations. So a very busy place. I want to thank you for joining us. And sending warm thoughts. Hello in Texas. Thank you for joining us. In Greenville, South Carolina. Thank you for joining us. From Southern Indiana. And I'm going to send you warm thoughts. Keep warm this evening. And have a pleasant evening.